Brian Eamon, joined with C4 with our next guest, who is the head of pediatricians at GBMC, Dr. Timothy Doran, pediatrician, chairman of the Department of Pediatrics at GBMC. Great to have you on.
Good morning,
Appreciate
Doctor.
your time. There's so much to talk about regarding kids. I guess we want to start off with, we've talked to you several different times. And now we're into January, New Year 2021. What more do we know? What new things do we know about COVID-19 and its impact on children?
That's great. Yeah, nice to be with you guys this morning. We do know some things. Actually, yesterday the CDC just came out with a very important paper in the Journal of American Medical Association, and really recommending that children be back in school. The studies that have come out so far show that in-person school is safe, and in terms of the effect on children, that we should be doing everything we can to get children back in school, whether that be with proper precautions, with masking, with distancing, with hybrid schooling if that's necessary. So that's probably the most recent, newest thing about children and COVID.
Dr. Timothy Doran, once again, is on board with us. You're listening to the coronavirus, our latest town hall in a series of town halls that we have virtually with GBMC Healthcare. Dr. Doran, when it comes to now, since March, a lot of kids have not been in a classroom since March. As a pediatrician, as you talk with others, what are they finding when it comes to children at this point, socially, emotionally? What are you seeing?
Well, it's been bad. I mean, we've seen what we expected, which is the social isolation in children, especially in middle school and high school, can be very difficult. Depression, we're seeing other problems with children being cooped up at home, not being able to interact with their peers, but also, especially for more disadvantaged children, that it's about food, it's about social services that they get. It's about all the things that happen in school, not to mention the child care issue of all the mothers who are, and some fathers who are leaving the workplace because they need to be at home with their children doing remote schooling.
Do you get frustrated? Because, I mean, you've been telling us this for a while now, and we've had other pediatricians on, and my own private pediatrician has said similar things about there's just, no reason why we can't get kids in the schools. Do you get frustrated that pediatricians, it seems to me, when it comes to the schooling question, have been left out, and that we do deal with the infectious disease doctors and how they feel all the time, and that has been more of a say than what pediatricians have had to say regarding kids in schools?
Yeah, I mean, it is difficult. The voices in this issue are mostly the politicians, so that, it is a difficult task to advocate. I know that the Academy of Pediatrics has been to Annapolis in terms of trying to lobby and help with this issue, but it's, as you know, it's a very difficult, fraught issue, especially for teachers and their concern about their own safety.
Dr. Timothy Doran, once again, he's the head of pediatrics over at GBMC Healthcare. And Dr. Doran, without getting you involved in politics, I'm not trying to get you in the middle of a fight, but I do have to ask you, there's been discussion of children not going back to school until they get a vaccine. Is there any medical reason that should happen before they get back in the classroom?
Well, here's the situation. The risk that we worried about with children in school is a community risk. We know that children are really not impacted at all. Not at all. They're not impacted greatly by this virus. They have sort of innate resistance to it, and they clear this virus very quickly. So they don't get very ill. I looked actually last night before coming on today. There have been 77 deaths in children between 0 and 4, and only 180 deaths in children between 5 and 17. And that's when you consider you've got 400,000 deaths in the rest of the population. You've got 97,000 deaths in people over 85, and you've got about 200 deaths in children. Now, we don't want any deaths in children, so we do want them vaccinated eventually. But the concern was community spread, and it turns out that's not the case, that there isn't really any more community spread than there would be if they were at home and in the community themselves. So, the vaccination issue for children is they're just now beginning to do studies on children 12 and above. The Moderna vaccine is available for 18 and above, the Pfizer vaccine for 16 and above, but we don't have studies on children between 0 and 12, and that's going to be probably at least more than a year or maybe a couple of years before we know what the effect is on children that young.
I mean, it is possible, right? They won't even need it. It's kids that are.
Well, no, we think that's a great question. We do think they will need it because we do. Well, children are being born every day, so there are going to be millions of children who are growing up who have not been exposed to this virus. But we vaccinate for diseases that cause fewer deaths than this. And because we can eliminate them. So if we can eliminate 200 deaths, then that's great. I mean, obviously it's a low number compared to the larger number, but anything we can do to prevent that is terrific. And there is some, they do spread it to other individuals, and mostly in their household, but children are spreaders of this virus, so we want to prevent that too. So there's direct effect, which is to protect the children, but then there's the indirect effect of protecting the community.
You're listening to the Coronavirus, our recent town hall special that we're having virtually with GBMC Healthcare, Dr. Timothy Doran. When it comes to, and you oversee other pediatricians as well, the trust that has to be between parents, guardians, and pediatricians, because you get a lot of outside information from a lot of folks. How can pediatricians build the trust to let parents and guardians know, what to do with their kids?
Yeah, well, I think that's important. I think they need to certainly to listen. And they need to be very direct. They can't be imperious or feel like they, make them feel guilty about anything because it's their child. But I think that pediatricians are in a perfect position to develop that kind of trust and to talk to them about it. And I certainly have this experience on a weekly basis of discussions with parents. And it's about listening. It's about being honest and straightforward, and it is about trying to counteract some of the disinformation they're getting on the internet, because it is pervasive.
There are a lot of grandparents who haven't seen their kids, grandkids in person, right, for a very long time, and they've been just waiting and wanting to do that. When they do get the shot, let's get a 76-year-old gets the shot today, 6 weeks from now or a month from now, depending if they get Moderna or Pfizer. Is it safe for them to have their grandkids over to their house once they get the vaccination?
Yeah, well, so first of all, the vaccination, you need to be about a couple of weeks out from your second vaccination. You're not protected after your first vaccination. Studies show that maybe 30 to 50% protection, but not the 95% protection with the second shot. So you need to be out from that shot. And at that point, I think it would be safe. I would be careful visiting those households to still mask for now. And I wouldn't be kissing your grandchildren at this point. But, with some caution, yes, I think it will be.
Dr. Timothy Doran, we're now 10 months into this nightmare, really, of COVID-19. What are some things, a few tips that you can give parents? I mean, they've already done some things. What do you suggest they do as we're moving forward?
Well, I think it's important for people to get out. I know it's cold, but in Scandinavia, there's a mandate for kindergarten and first graders to be outside 50% of the day. So I think to get outside is helpful. I mean, to be cooped up in your house gets to be very, very difficult. To exercise, I think, is really important, and to maintain social interactions as much as you can through the internet. I know a lot of older children are middle school and high school are interacting with friends that way, or gaming with friends, or whatever it is that they can get enjoyment from. But I think it is to kind of get outside of yourself in a healthy way. Well,
I know that play dates are probably not a good idea for inside, but what about kids playing, tag, or playing, baseball or whatever, or just being kids outside?
Yeah.
Is that okay?
So that's I mean, outside is really important. When we look at the school issues, the problems that have come up have been on indoor sports. So there was a wrestling tournament, and half the kids ended up getting COVID. That's the danger is inside with a lot of contact. So baseball, tag. I mean, things like that where it's just very brief interactions are much, much safer. And certainly, I would certainly recommend that children do that. I mean, it's going to get pretty cold here, but I grew up in New England, and we had lots of fun outside in the cold.
It's better than being on an electronic device all day.
It really is. And Dr. Timothy Doran, Chief of Pediatrics at GBMC Healthcare, just parents are frustrated right now. And I'm sure not only are you hearing, they want their kids healthy, but the frustration is going on that their kids aren't in school. So what do you say to parents, as frustrated as they are?
I would say that they can advocate through their PTAs to now that they have these recommendations from the CDC, that we should be really promoting in-person schooling. I think they can get involved politically, so to speak, in terms of advocating in their school systems to get schools open. I mean, I think that's really critical right now, is to really get kids back in school, not necessarily full-time, and also the option for some parents who just really don't want to do that to be able to do remote learning. But I think it's time for people to come together and make some recommendations to the school boards.
Thank you, Dr. Doran.
Thank you
Great
so
to
much,
have you
Dr.
on.
Doran.
We really appreciate
you.
Your
made
time.
Brian's morning,
nice
by the way.
to be on with you guys. What's that?
Thank you. You made Brian's morning with what you're saying about that study and everything.
Yeah, I know.
It's JAMA, JAMA. You can go get it.
He will.
Plastered all over social media. Dr. Timothy Doran,
thank you so much.
pediatrician and chairman of the Department of Pediatrics at GBMC.